Thank you for your time. I'm here to present kind of a unique perspective on what personally we've learned on the efficacy of masks. I ask that you kind of throw out all preconceived notions. I know we're all getting all sorts of different ideas about masks from both sides, from media or whatever, but I just want you to really listen to our experience and what I have to say. My name is Jamie Bell. My husband Troy Bell and I, we own 9 nursing homes and assisted livings throughout the state of Idaho. We care for hundreds of the state's most vulnerable and fragile elderly individuals. Since the onset of COVID in March of 2020, our hundreds of dedicated employees have strictly followed CMS, which is Centers for Medicare and Medicaid's requirement, which is every employee correctly wear a medical grade surgical mask 100% of the time when they're at the facility. We also utilize gloves, gowns, goggles when caring for these individuals. Our hand washing and hand sanitizer protocols are extensive and clean. Our employees have spent hours in detailed trainings on how to follow these regulations. We also have implemented the CMS requirement of absolutely no outside visitors in the facility, as well as considerable social distancing between patients. So hundreds of our residents were basically isolated to their rooms for many months. The only human interaction that came was from their caregivers, who were wearing medical grade surgical masks 100% of the time. Finally, we followed the requirement of testing every single employee for COVID-19 every single week and testing patients often. At any sign or symptom from a patient, the entire facility was tested. So we always knew exactly when and where COVID was in our buildings. Despite these extraordinary measures, COVID-19 still spread like wildfire through all 9 of our facilities. Nearly every nursing home across the country who many followed the same measures experienced similar outbreaks. Many will say that the employees brought this from outside, which is true, that's how it got in. However, hundreds of patients who never left the building and never had any interaction with anyone besides their direct caregivers, who all wore the masks and gloves, still contracted COVID-19. Many of these patients, as an extra precaution, would themselves wear a mask if their respiratory health would allow it. And many of these patients were still infected with COVID. Despite diligent testing, exceptional compliance with mask and glove hygiene, we could not prevent the spread of this virus. The struggle of preventing the spread is real, and the challenges are real. I understand the difficult situation you guys are in as board members. You're receiving a lot of pressure from all sides, but all politics aside, the information I've shared with you is from a real, first-hand, controlled environment. No other entity could probably assess the effectiveness of masks. Maybe prison is about the only other place that could do it the way we did it. And could isolate individuals and control contact like we had. Overwhelmingly, our experience has proved that masks don't work. The CDC has indicated that cloth and surgical grade masks do not prevent the spread. I wish they did. I wish that there was an easy solution. But as the new Delta variant has emerged, our experiences unfortunately been the same. So far, 7 of our 9 buildings have had an outbreak, despite continued diligent compliance with masks and guidelines. But fortunately, as nearly all of our patients have taken the vaccine, and many of our staff have received the vaccine, our data this time shows that those who've been vaccinated have much milder cases, a mild cold. The death rate has been 0 so far. Sorry. I know we need to wrap it up. I know we want to control everything, but this is something that we can't control. And if masks worked, I might support it. But our experience shows that they do not. And despite our incredible efforts to make them effective, when it would get in a building,